speed around my second year of residency. It helped me a lot. Almost we were close to good in the where I started reading more and more. I really liked the neurology part. Amazing, sir. The way of teaching, sir. It is very amazing.
We want to wish you on behalf of the entire Speed faculty and team and the institute to you a great achievement. Congratulations for your making up of rank 103 in DM Medical Group in NEET SS 2025. Congratulations to you on that. So can we know a brief background about yourself, where you started till date, what all you have done?
I have done my MBBS from Shri Aurobindo Institute of Medical Sciences, Indore, and I have done my MD from Index Medical College, and I have taken. This was my second attempt. Last time I got the rank of 4,000. Modified my strategy, analyzed my weak points, and tried to overcome them.
Great, doctor. 4,000 to 103, 4,000 plus to 103. I
Yes,
mean,
sir.
that shows how much you are persistent, consistent, perseverance, hardworking, and focused with a clarity. I could see through you a kind of uh, specialty. What is your interest? What super specialty you wanted to do?
Sir, currently my interest mostly it has always been in medical gastroenterology because I like being in the procedural field more, going to OTs, doing diagnostic and therapeutic procedures. That has always been a boost for me. So that is what I'm planning.
So you are an interventional man. There's a background of personality behind Rohan. Okay, I want to do intervention. Come on, I need to do something. It's not only medicines, I need to do something.
Yes, sir. Yes.
Probably there is a surgeon in you as well.
Yes, sir. Actually, sir, in my NEET PG, I almost got MS surgery, but my preference was always towards medicine side more. But doing junior residency in before my post graduation, I had exposure to OTs, so I kind of liked it going to OTs and all those things.
Great, great, very nice. Doctor, can I know from you? Uh, you said last NEET you got around 4,000 plus rank, and from there you changed your strategy and you worked towards it, and been now today on 103. What was the strategy? What was the success strategy and the mantra that you followed? Can you share on that so that everybody can know?
So last time around, I tried very hard. I solved many MCQs. I read through theories, but most of the MCQs were like shooting in the dark. I could not gain clarity from it. And during the question paper, when I saw the question paper during the first section, I thought it to be more on the difficult side. I was having difficulty managing time and answering the question properly. So I changed my strategy. I analyzed the paper, and I knew kind of that it is always going to be unpredictable. So I had to cover more. I had to cover the topics which are important in depth, and I have to cover the rare topics, just the basic stuff. And also the main thing, I after every topic, I I made my own notes. I developed an understanding of each topic, and at the end of the topic, I used to ask five questions to myself: that am I able to answer? What is the next immediate step? What is the next step? What is the next best step? And what is the definitive step? I think this helped me a lot.
Great. Now, what you found you were lacking previously and what you found that you matched it after doing this?
Uh, Sir, last time I focused more on factual knowledge as compared to the approach-based knowledge. I think I changed that to preparing I designed my notes in that way that the questions which come are usually approach-based nowadays and less of factual knowledge. So, and during a residency, most of the during the university examinations and all, we mostly cover the factual stuff. So I did not focus much on that. I focused more on giving grand tests and solving MCQs, which were more approach based.
Good. Great. How many questions you are able to answer this exam?
Sir, I attempted 146. I don't know how much I got right. My marks were around 404. So this must be around 110 or something.
Can you share something about your opinion about this paper?
The papers are, it will always be unpredictable, but I think the common areas where they keep on asking questions, like last time also, from the year 2023, they have been asking heavily on the nutrition topic. Like there are always 3 to 4 questions on vitamins. There are a few questions on feeding, like when to do enteral feeding, when to do parenteral feeding, and all that stuff. Last time they asked toxicology, that was a new. So I struggled a lot in toxicology. So I had been thorough during this year preparation, that I covered thoroughly the toxicology part, which helped me a lot because this time, environmental emergencies was asked heavily. Rest of the papers are, I feel, it was doable.
Okay, great. Who introduced speed to you, and what was your experience for the speed learning for this exam?
It was suggested to me by one of my seniors, actually, during my residency. I took speed around my second year of residency. Actually, I had a quiz for rheumatology. So I covered the complete rheumatology, Dr. Arun Sir's, in, I guess, 3 days' time. Uh, it helped me a lot. Almost, we were close to doing good in the quiz. And from there, I started reading more and more. Uh, I really liked the neurology part. Dr. Joban Preet sir, amazing sir, uh, sir way of teaching sir. It is very amazing. He, kind of makes it easy to, remember the neurology, which is a very vast subject to study. And as Dr. Azim sir's cardiology, sir, I focus them. I followed them religiously, sir.
Main systems.
Yes.
Great. Now, thanks for sharing. Faculties will be very happy, listening to this great words of their work. And that's the reason why I asked this question, so that a team will also feel very good about it. Now, I want to ask you, what is the message that you want to give for the future aspirants of DM medical group students?
So for the droppers, I think focus more on building an understanding of the topic rather than mugging the topic. Some one of my seniors told me that there will be 100 questions. You will know 50 of them. 50 you can guess, and that will be for most of the students. So don't give up on an MCQ. Attempt every MCQ. If you have read the topic, if you haven't read the topic, try excluding MCQs, try excluding options, and you know even the toppers don't know 100% of the paper. So I followed that, and the approach to each topic, that what is the next step in the management, what is the immediate step in the management, what is the definitive management, and what if fails. Focus more on this part during my preparation. So I'll this is my advice to all the upcoming aspirants. For the residents, I think, sir, they should focus more on patients on follow, because like there was a question on thyroid, hyperthyroidism, that you have started a treatment and how will you continue the treatment, and so I guess that would be very helpful to just follow up the patients, keep a track on it, and read about it, that if you have done right or wrong. So that will be very easy in the future.
Great. Thanks for sharing, because it'll be useful for students who are watching this. And time to thank, and whom all you want to thank, you feel that stood by you from day one till date, helped you to achieve what you are today.
I would like to thank my parents. They have, I guess, this was their dream. This has always been their dream, and I'm proud that I've made them proud. My brother and my sister-in-law, they helped me a lot. Even they, taught me a few biostatics concepts. So I was very weak in it, and uh, the share goes to them equally. My family, sir, and my mentor, Dr. Amit Agrawal, sir, my teachers during my residency, Dr. Khanam Madam, Dr. Abba Madam, Dr. Maurya, sir, and of course, sir, the speed faculty, sir.
Great, doctor. Wonderful that you could acknowledge and thank all of them. And
You know,
it's great. And once again, I wish you all the best and all the success for a great, wonderful, and amazing career in DM, medical
thank you,
gastroenterology,
sir. Thank you,
and
sir. Thank you so much.
best wishes.